Today we have this nice patient here who is young, but she would like to improve her appearance. And what we're going to do is we're going to inject Juvederm into her nasolabial lines. And I'm finding in young patients they're seeking these procedures earlier and earlier because they don't like the signs of aging and they want to look like they did when they were in their 20s. So we're going to demonstrate here how simple it may be. So the product comes with lidocaine, and so it numbs as it goes. And our patient today happens to be a nurse, so she has lots of experience in medical procedures. And sometimes nurses and doctors can be not the greatest of patients, but I think today we'll demonstrate how well and the potential healthcare providers have. So just relax. We're going to start on the bottom. We're going to inject, and I always like to go through the spot that was just done, so it's as comfortable as possible. And you see the line almost disappears as it happens. And she's being a very good patient. She's even eyes open, concentrating on what is happening. The Juvederm, when it's done correctly, can last a long time. What's a long time? It can last a couple of years in this area when it's done optimally. I'm going to come down here and do a little bit down here. And she's doing really well. Sometimes I go back from side to side just to, my patients have done it for several times, but in her case, since this is her first time, right? Mm-hmm. We're going to show her what it looks like one side before we go to the next side. I have lots of patients come in and say, I had injectables, they don't work, and it only lasted a few months. Well, if it's not done correctly, that can happen. So let's see. We can give her the mirror in 1 second. You're feeling it, but it doesn't hurt. I mean, you're flinching a little bit, but not.
No.
For a patient and a nurse, you're doing really, really well.
I'm also a girl, so.
What does that mean?
We do better with these things.
Exactly. I was thinking the other way around. When you said that, I was thinking, no, women do better with this than men do. Sometimes we'll put topical on, but it's usually not necessary. So that looks pretty good. We can give the patient her mirror. You're supposed to say, wow, looking good.
Wow.
You see the difference?
Yeah, I do.
Let's wipe this off. Left side looks a little bit deeper. Mm-hmm. So we're going to start again. And the first one's to be the most uncomfortable. So this may last her 1.5 to 2 years. And she's doing great. Next, we're going to do Botox in her. And the Botox, she's a great candidate for Botox. She has a few lines of expression. Really not a lot of lines of rest. And she had Botox for the first time a few months ago, and she loved it. And you might, on the camera, you might see that there's a little faint line where her kind of fold was before. That usually gets better because the line has a little bit of memory, but that will get better in the next week or so. But I have patients concerned about the expense of what the products cost. And the products, when they're done and injected optimally, it's economical. The problem is when injectors do it that inject it too deep or not correctly, and the product then dissipates. I have very few patients that come back and say, it didn't last long enough for what you told me. So we're just about done. And you're going to work tomorrow?
Mm-hmm.
Possibly today. Her phone's been ringing.
Possibly today. Oh boy. People calling in sick.
Mm-hmm.
Okay, so that's the Juvederm. And how was that for your first treatment? with
Not bad.
Juvederm? Good.
Not bad at all.
So next we're going to do Botox. I'm going to sit her back a little bit so she's a little more comfortable. Botox is very predictable and very reproducible when the provider that's doing it has done it for many years, and it becomes second nature. There's very little complications. So first we're going to do around her crow's feet. Smile for me, which she really doesn't have a lot of crow's feet. Or you can relax. Smile again. So Botox done well, smile. We'll get the lines from this part of the eye, which is called the lateral canthus, out. There's some lines, she has a few little faint lines, I'm not sure if it comes out in the camera, that will still be there. But she's a great candidate for Botox. And then we're gonna go up to the forehead. Frown for me. She really doesn't have a lot of frown lines, but she probably doesn't frown often, because she's a very happy patient. And once again, when Botox is done optimally, it lasts 3 to 4 months. And the results are natural looking. Raise your eyebrows. Relax. Raise again. And we're all done. So hold pressure here. And so that was Botox of the crow's feet, the glabella, and the horizontal lines of the forehead.